And so my learning of Ayurveda is more from the clinic. Because everybody has a right to mistrust Ayurveda. And just because it belongs to our past, just because our ancestors were involved in it, we need not believe it. To ask intelligent questions, you need to know the subject. The end point of a medical system is for treatment. Sanatan is, eternal, something that doesn't change. So Ayurveda is a theory-based system. No medical system has answers for everything.
Welcome to KanhaCast, the podcast from Kanha Shantivanam, the International Centre for Heartfulness. Today I am speaking to Dr. Rama Jayasundar. Dr. Jayasundar is a distinguished professor and head of the Department of NMR and MRI at the All India Institute of Medical Sciences, New Delhi. She earned her PhD in NMR physics from the University of Cambridge, UK. She decided to pursue medicine in 1994, but it took her 8 long years of struggle and she finally joined the course in 2002. With official permission, she did a 5.5-year professional medical degree course, making her the only person in the world to have a PhD in physics and a professional medical degree in Ayurveda. So namaste, Doctor. Thank you so much for being here. It's been a real honor to host you at Kanha Shantivanam, and you've had a hectic schedule. 2 talks you gave, really enlightening talks, and it's such an honor to host you. Thank you for accepting this invitation to come into the studio and have a chat.
It's my pleasure. It's my pleasure and honor to come and share some of my thoughts on Ayurveda. And it's a lovely campus here. And I feel very privileged to be here. And thank you for asking me to, come to the studio and, have a chat with you.
No, it's completely our honor. So you were talking in this morning that your background was in physics. You studied physics. And then at the age of 41, actually, you decided to study medicine. And of course, you could have studied conventional medicine, but you chose to go with Ayurveda.
Yeah.
So what was the motivation to go with Ayurveda? Because all your training had been designed towards go to conventional medicine, right?
Yes. So I joined AIIMS New Delhi in 1993. And because it's a medical institute, all our work, the endpoint should have some clinical relevance. So although I was trained in as a MR physicist, I was shifted into biomedical MR. And initially when I started working, I had collaborations with neurosurgeons, and I was doing what is called MR spectroscopy of brain infections and brain tumors. So my collaborator used to send the patient saying that this patient has a thalamic tumor. I wouldn't know where thalamus was. So then I started attending the anatomy classes with the first year MBBS students. So I know, also the doctors are very busy. They are not there to tell where thalamus is and where this is.
Yes.
It was up to me to learn. And then, when I do MR spectroscopy, we are looking at biochemical information. So I have never studied biochemistry, so I started attending classes with the MBBS students, the biochemistry classes. Then very quickly, I felt that this is not going to work. I can't do insightful research, with borrowed knowledge, that I should have the insider's information. So that's when probably it was 1994, I felt that I should have a MBBS degree. So this was more to help me do insightful research. So I was not interested in practice, but for research work. So I started looking into options of doing MBBS. And so even as I was exploring the possibilities, I came across an article. These were done by a group of physiologists. So the article was on the memory enhancing property of Shankapushpi. Shankapushpi is it's a medicinal plant, and
yes.
Then it's a flower. That name is called Shankapushpi. And so when it was a chance reading of that article. And so it said that Ayurveda claims that Shankapushpi actually increases the memory power. So they had designed a small experiment, that maze experiment where there is a maze and at one end you have the bait, and then, they train the little mouse to find the bait.
Yes.
So then they had administered the decoction of Shankapushpi, and the hypothesis was that if this really enhanced the memory of the little mouse, then it wouldn't require so much training, right? So, but that was not what the result showed. The result, there was no difference, if I remember right. And so the conclusion of that article was the claims. They did not say that the Shankapushpi decoction did not increase the memory. That was not what they said. They said that the claim made by Ayurveda was not right. It was a wrong claim because it's not enhancing the memory.
Oh, so they framed the entire Ayurveda.
Yes. So, I mean, if I had done that experiment, I would have simply ended saying that it does not enhance the memory.
Correct.
So I felt I had no background in Ayurveda, and I don't come from a family of Ayurveda. I have never ever taken Ayurvedic treatment as well. But somehow didn't seem right. Something didn't seem right there. So I contacted the group which published this, and I asked, I want to talk to the Ayurvedic doctor who is part of the team. They said, there's no Ayurvedic doctor in the team. And they said, why do we need? I said, who gives this information? They said, it's all in the book and, it's translated. We took it from there. So again, something was jarring for me. And then I contacted somebody who knows Sanskrit, because Shankapushpi is called a Medhya drug. Medhya is not memory. Medhya is beyond memory.
Oh.
Okay, it's not, the translation is not memory. Okay, so then he said that it is not memory. It goes beyond that. It's much more subtler than that. And then I also contacted an Ayurvedic doctor, and they said that what we call as Shankapushpi is not the Shankapushpi that, it's written in the text. So there's a difference. So they were looking at the wrong parameter. They were also using the wrong ingredient.
My goodness.
And probably that was a starting point.
They smeared all of Ayurveda just based on their mistranslation.
Yes. I mean, I didn't even look at it as smearing Ayurveda because, I didn't have any exposure to Ayurveda. I didn't have any emotional bond or anything. So I didn't even look at it that way. I felt that this was not a scientific way of doing things, right? That you need to have a domain expert. Right?
Absolutely.
And without having a domain expert, you are indulging in something and you are using the wrong ingredient, looking at the wrong endpoint. So probably that was the trigger. I mean, when I'm looking back, I feel that must have been the triggering point. So then I decided that probably, it would be, I decided I will do Ayurveda more to find out whether it's a science, whether there is anything in it, and whether it's worth talking about it, and whether as a scientist, when I study, maybe I thought I may be able to understand this better. And then I appeared for the entrance exam, medical entrance exam, which is common for all the medical streams. So it's the same medical entrance exam that MBBS aspirants do, appear for. So I wrote that, and that was again, I wouldn't like to do it again because, it's so much information that you need to remember.
Of course. It's almost like a test of memory. Yeah?
Yes. And then, it's something for a 18-year-old, not for a 40-year-old. And I have never been known for my memory because, student of physics, you don't have to memorize anything. So I have never memorized anything. You understand the concept and then, whether it's mathematics or physics. So at the age of 40, memory, everything declines. And so I put up a very brave effort. And my husband actually took me to the exam center, and I refused to enter the exam hall. I felt I just went blank. I couldn't remember anything. So I told my husband, no, I'm not going to write this. My husband said, no, you have come this far. Nobody knows you are writing. Even if you fail, it doesn't matter. So he said, you have come this far, you will have to go. So he was the one who actually pushed me literally physically into the exam hall. I did very well. It was not as bad as I thought. Things came to my mind, and because, fastness, and you have this multiple choice as well. And you have negative markings as well. So even now I'm very proud to say that I got the 7th rank. And by
Wow.
virtue of that, I was eligible for MBBS admission. But I opted for BAMS, which is Bachelor of Ayurvedic Medicine and Surgery. So it was, I was apprehensive, I should admit. I did not know what I was going to go in for. So I told myself that I will see for a year or year and a half. If I find it very unscientific and very empirical, I thought I will go back to MBBS. I did not do that. So you know what I think of
Yes, yes,
Ayurveda.
absolutely.
So it's a big story.
But it's such a it's so true that one has a doubt about Ayurveda, even because even though we've grown up here in India, but we've educated in institutions that were set up perhaps by the British, or so we have this innate sort of mistrust of Ayurveda that perhaps it's not scientific. It's a kind of a mindset that we have.
I don't blame them. I don't blame at all. It is everybody has a right to mistrust Ayurveda because you see, logically, we are all living in the age of science and technology. And some of us are part of the research and
Absolutely.
development as well.
Yes.
And we see the rigor of science, right? And so we are talking about a system which is, at least 5,000 years old. It is very difficult to believe that things could have been done in a scientific manner. Technology was not there. There was no MRI, there was no, CT scan, there was no microscope. So, because we also link science with technology, use of technology, it is very natural for people to be skeptical. And I think it's very important to be skeptical. Otherwise, we will be, we shouldn't be swept by emotional.
Absolutely.
We need to be very, very objective because we are talking about a subject which deals with the health of people. So it cannot be trivialized. And just because it belongs to our past, just because our ancestors, were involved in it, we need not believe it. We should not believe it. It's not, even our acharyas would not agree at all. They themselves say that don't believe things, just blindly. You will have to question, right? So mistrust is natural. There is nothing wrong. Skepticism is a must. Criticism is also a must. But where we should know where to draw the line.
Yes.
And even to criticize something, you need to know about the subject.
Absolutely.
So, for example, if I'm a historian, can I say that I'm skeptical about quantum mechanics? Or can I say I have criticisms about? I cannot, because I do not know. To ask intelligent questions, you need to know the subject.
Know the subject.
Right? So the problem now is that people, without knowing about Ayurveda, they are questioning. That is where the problem. Questioning per se is not wrong.
Is it the other way around also? I mean, of course, there's many questioning, but also many championing Ayurveda without knowing.
Yes, this is another, very big problem for Ayurveda because we have a lot of well-intentioned people. And, I always tell in my talks that, by virtue of being Indian, everybody thinks they know about Ayurveda. They don't realize that it is a rigorous medical science. And so even if you look in modern medicine, allopathic medicine, you will not have a cardiologist giving talks on dermatology or a dermatologist giving talk on neurology. The demarcations, specializations are very, very clear, right? But when it comes to Ayurveda, you have all kinds of people, talking about Ayurveda. They don't realize that it is damaging Ayurveda. So there are lots of assumptions and presumptions about Ayurveda. For example, Ayurveda does not have an emergency medicine. Ayurvedic medicines work very, very slowly. Ayurvedic medicines don't have side effects. So there are lots of, misinformation. So this is something that needs to be looked into.
Yes.
And to see how to educate people and convey to them that Ayurveda is as rigorous a medical science as modern medicine. And it is not something that anybody and everybody can talk about.
That's so wonderful to hear. Also, you mentioned that you went into your Ayurveda degree with a very open mind. You said you'll see for 1 year.
Yeah.
If you find it's too much of, it doesn't fit
Empirical,
in, it's
yeah.
not scientific enough, you would drop it. But so was there a time or was there a particular thing that you felt, no, this is scientific? How did that conviction come?
So, what I did was literally from day one, I was, sitting with the Ayurvedic doctor in the clinic and seeing, because, Ayurveda is not something that you can learn from reading the textbook. So you have to see what is how treatment is done. So I was very, very fortunate to work learn under an Ayurvedic doctor. Her name is Dr. PLT Girija. And in my opinion, she is one of the best doctors, Ayurvedic doctors in India, according to me.
She's based in Delhi.
She is placed in Chennai because
Chennai.
I did the AIIMS from Chennai.
Chennai. Okay.
And she practices, well, I don't even want to say pure Ayurveda. Then it means that there is something like impure Ayurveda. She practices classical Ayurveda, where she diagnoses based on Ayurvedic metrics, and the treatment is also based on Ayurvedic diagnosis. And I remember one of the patients, she had multiple sclerosis, and she was a 21 or 22-year-old young girl. She was studying in Australia, and she was brought into Dr. Girija's clinic. I was there at that time with Dr. Girija, and this girl was, her parents were holding her on both sides, so she could not walk. She did not have bladder control. She was losing eyesight, and our extremities will go hot and cold, alternatively. And so her deterioration happened in a very, very short span of time. And they had the MRI, they had all the parameters, the biochemical parameters checked, and so they brought such a big file. And going from a MRI background, I was very interested in looking at the MRI scans. And so I was looking at those MRI scans and other test reports. And then when I looked up, this doctor was looking at me and she said, "Have you finished?" I said, "Yes." And then I was looking at her. I was waiting for her to ask for the folder to look at the MRI scans and to do the diagnosis. And she didn't say anything. But then when I asked her, she said that my diagnosis is over.
Wow.
And I thought, no wonder people are criticizing Ayurveda. So here is a doctor who doesn't want to look at the MRI. Not that she doesn't want. She didn't ask for it. She is not looking at any of the diagnostic tests that were done. And I didn't see her do anything, in particular, but she said she has diagnosed. And so I literally went into a shock. And then the thought was going on, should I switch over to MBBS? And, if this is the way they are going to diagnose, and, what kind of treatment would be given.
So there was not even she didn't treat the pulse or anything of that?
No.
Oh.
No. Okay.
Wow.
So, but then I saw how the treatment was given and how step by step she did explain the logic behind the treatment from an Ayurvedic perspective. And also, how the patient recovered.
Wow.
And that was a big eye-opener for me. That's when it struck me hard that they have their own metrics for diagnosis. And when I thought about it, it made sense. See, they say that Ayurveda is a medical system. The endpoint of a medical system is for treatment.
Of course.
How can they treat if they don't have a way of diagnosis, right? So that was it came very early on, and then I have seen many patients, who have had a allopathic diagnosis and the treatment had not worked, and then coming to this doctor for Ayurvedic treatment and how she makes the diagnosis. And, so it has been a big eye-opener for me. So that's when I realized that, it's something that needs to be looked into very, very carefully. And so my learning of Ayurveda is more from the clinic. than from the textbook. Because text is, the Sanskrit texts are very, very cryptic. And so there are, all the texts have commentaries, but
And a lot are missing, as you were saying yesterday.
lots are missing.
There are lots of gaps in the
A lot of gaps,
literature.
and the syllabus itself doesn't give you time to read commentaries, right?
Hmm.
You know how our education system is rote learning, and then you have exams. In Ayurvedic course, BAMS, I feel is, see, when you talk about professional courses, they say that medical degree is the most difficult because it's so information heavy.
Hmm.
And I would say Ayurveda is BAMS is doubly, triply more difficult. It is the most difficult professional, degree, because one is Ayurveda is you have to study in Sanskrit. Just like you can't study MBBS without knowing English. You cannot study Ayurveda without knowing Sanskrit. So I do not I do not know anything on Sanskrit. So I had to learn from the scratch.
Wow.
So that's a personal thing. But otherwise, for the students, all the students do +2 and then come. So they go through the regular, maths, physics, chemistry, biology. So this is a big shock for them. How things are explained, the terminologies, everything is very, very different. So it's very difficult for these children also. And you have to by heart the shlokas, you have to repeat it, reproduce it verbatim. And we also study 70 to 80% of MBBS portions. People don't realize it. So if it's pediatrics, we also study modern pediatrics, also Ayurvedic pediatrics, right? So it's like studying for a dual degree.
Wow. And you just mentioned you have to study shlokas as well. So how does that fit in? There's of course the diagnosis that you were doing in the clinic, and but
See, the shlokas actually help you remember things. So, for example, even the modern allopathic doctor, they have to have so much information in them. A patient comes with a set of symptoms. They go through the clinical history. They have to make the connections very quickly for these set of clinical symptoms and for the kind of case, the patient history, what will be the diagnosis. Of course, they use technology extensively. So for Ayurvedic doctors also, so you need to remember the set of clinical symptoms, then you do the diagnosis. You should know that, this disease has these symptoms, right? And the best way to remember is through shlokas, because there is a chandas to it, there is a beat, rhythm to it.
Mm-hmm.
It's very easy to remember it that way.
Absolutely. You mentioned this morning in your talk about 5,000 years ago, the conference in the foothills of the Himalayas, Ayurveda. So this is a very ancient system, but has it, has it kept pace with the evolution of lifestyle, is it continually evolving? Can we use the same ingredients that they were using 5,000 years ago now?
See, what they have done is, they have used parameters which will not change over time. Okay, so you look at the parameters that they talk about. They are talking about dryness, stiffness, fluidity, roughness, coarseness, temperature, acidity. So 5,000 years ago also, all these parameters were there. You can have dryness in the skin, the temperature can increase, acidity can be there, you can have a stiff back, you can have a loose motion where the fluidity is increased. So 5,000 years from now also these will be there. So these are parameters. So what we call Sanatan is eternal, something that doesn't change. So they are using parameters which will not change at all. So even when they talk about properties of food or properties of the plants, they are using parameters which is not going to change. So for example, something sweet, 5,000 years ago also mango was sweet, banana was sweet. Now also 5,000 years later it is still sweet. Maybe the degree of sweetness may differ, but suddenly banana is not going to become bitter.
Yes.
Unless we do a GM modification.
Yeah, that we are doing now.
Right. So they were giving very broad-based theories and concepts which can be applied at any point in time. Right? So, which is why Ayurveda is able to, the Ayurvedic Vaidyas are able to treat diseases which were not known, at the time of Charaka. So, for example, COVID, even when chikungunya. So, I remember that when I was doing my BAMS in Chennai, that was when chikungunya epidemic had happened. And it was the Ayurvedic Vaidyas and Siddha Vaidyas who were actually treating the chikungunya patients very effectively. The questions that were asked was, this virus was not known even, couple of decades ago. Now, how can these Ayurvedic and Siddha doctors claim to have a cure for it? It's nothing but quackery. So what the Ayurvedic Vaidyas also probably did not know how to put it across is that they have a broad-based theory which can be applied over time. So as I told in today's talk, all the clinical symptoms are classified under Vata Pitta Kapha. So these clinical symptoms were there 5,000 years later, it will be there 5,000 years from now. Stiffness, body pain, loose motion, constipation, dry skin, exudation on the skin, throbbing headache, dull headache, cold, cough. Nothing is going to change, right? So all these symptoms are classified in terms of Vata Pitta Kapha. So whether it is multiple sclerosis or whether it is COVID or chikungunya, the symptoms, you have respiratory distress, you can have dry cough, wet cough, you can have body pain, joint pain. All these come under the category of, it can either be Vata, Pitta or Kapha. So you can actually make the diagnosis. It could be a Vata Kapha Jwara or, Vata Pitta Jwara. So once the diagnosis is made, then treatment becomes easy, because I told you that all factors which are used for strategizing treatment speak the same language of Vata Pitta Kapha. So this is how, this concept of Vata Pitta Kapha is actually a theory. So Ayurveda is a theory-based system. People find it very difficult to believe that, something could be theory-based. And but that's what it is. People may not agree, but that doesn't change a fact. It is a theory. That's how, they are able to, Ayurvedic people are able to diagnose and treat diseases. So they don't have to do research to diagnose a disease. It's either Vata, Pitta or Kapha. As I told you, when you say Vata, there are certain parameters under that. So, for example, if you take Parkinson's disease, it's a Vata Vyadhi, where there is increased movement. You have the tremors, right?
Yes.
So there is increased movement. Stroke, where there is a reduced movement, that is also Vata Vyadhi. You have diametrically opposite clinical symptoms. One, there is increased movement, the other, there is a reduced movement, right? Both come under the category of Vata Vyadhi. So you need to look at these parameters, biophysical properties, which comes under Vata. Okay? And that's how the treatment is given. So, there is this theory which is used by Ayurvedic Vaidyas to diagnose. They can, so in fact, Charaka Samhita very beautifully says that what we are giving you is a broad theory, using which you use your buddhi and yukti, and you can. And they say that diseases will come and go. You will have new diseases. It may be given new names, but it is old wine in a new bottle. It will again be, these parameters, Vata, Pitta, Kapha, which should have gone out of balance.
So it is future-proof in a sense.
It is
future-proof.
And so Ayurveda has always evolved. So it has never been a stagnant medical system. So you have books written till even 18th, 19th century books were written. And you can see the add-ons in it. But the basic theory doesn't change.
Remains the same.
It remains the same. So they must have, it must have gone through tests and, logical debates and discussion. And then, they must have come at this, this theory of Vata Pitta Kapha. So we do not know that kind of that development, what happened, but we know that it has been working. It still works. Right? So you cannot change, there is no need to change something that's working. Absolutely. What probably you will have to change is, you need to understand the modern lifestyle and the diet, and what kind of changes it would do to Vata Pitta Kapha is something we need to research, and that information is very important. We have so many new plants which are not mentioned during, in Charaka's time.
And
So
also with the connected world, you are exposed to diets that you weren't exposed to earlier.
Yeah. So, but Ayurveda has given the wherewithal to look into these. They have already given you the theories and methods to assess these. So we need to assess them, and then it will be much more easier to. But the Ayurvedic Vaidyas are already doing. They know what tea will do, whether tea will increase vata, what ice creams will do. Ayurvedic doctors, they are already doing it, but it's not experimental mode or anything. But when they see the patients, they see what kind of changes are there, and the only thing is that it would be good for them to document.
Absolutely.
Yeah.
Like for conventional medicine, you have the Lancet journal and things that are recognized worldwide as the authority. Is there such a body in Ayurveda? Do we have, because there's so many people practicing Ayurveda, and one is confused often that what is just Johnny come lately trying to cash in on the Ayurveda boom, or what is actually tradition that is based in research.
So there are journals. International journals are also there for Ayurveda and alternative medicine. But the irony is that if you publish in Ayurveda journals, you somehow are less scientific. People don't accept it. So, you are expected to publish in mainstream journals. And it's very, very difficult. Very difficult to, because the entire thought process is different. And the parameters you are looking at are unconventional. The terminologies, even if you camouflage it with correlate it and write it in English, it becomes very difficult. The rejection rate is very, very high. So you are caught. You're caught. You publish in Ayurveda journals, you're less scientific. So there are many people in the scientific. I'm basically a scientist, but I do know that many people in my own fraternity think I'm doing pseudoscience and I'm less scientific.
Because you are publishing in Ayurvedic journal.
Because I'm doing Ayurveda. Ayurveda itself is considered unscientific, and it's considered pseudoscience. I don't want to go into what I have gone through, but I can tell you the kind of mind block is mind-boggling. And so, things are very difficult for Ayurvedic people. So they are trained only to treat patients, just like MBBS doctors are. They are not scientists. So scientists, they have different kind of training. But the society, when I say society, the allopathic fraternity and the scientific fraternity, they want Ayurvedic doctors to do everything. They want them to explain Ayurveda in terms of modern terminologies. They want them to do research. They want them to tell which active molecule is present in which ingredient, and they want Ayurvedic people to provide the evidence and whatnot. So it's a very difficult time. Yesterday, somebody was telling that it's a very happy time for Ayurvedic people. I think it's a very difficult time for Ayurvedic people, because I know that there are many Ayurvedic doctors who believe in something, who do something else, because that is demanded of them. So there are Ayurvedic doctors who believe that the kind of research that's happening is not what should be done, but still they do it because they feel that's the pressure they are put under. So I think it's a very difficult time for Ayurvedic fraternity, because even the Ayurvedic people may differ with me, because the expectation is high, and there is a lot of visibility and lot of criticism, lot of expectations. So they are under self-imposed pressure, on what they should be doing. So there's a lot of confusion as well.
True.
So
true,
I think
true.
it's a very difficult time.
And one of the most common misconceptions that you mentioned just now is that everyone thinks that Ayurveda cannot treat emergencies. Emergencies is you straight away go to allopathic medicine. In fact, there's a joke that a person says there's three kind of friends. There's Ayurvedic friends, allopathic friends, homeopathic friends. The Ayurvedic friends look very good, but in an emergency, they don't help you. The allopathic friends, they are always there in an emergency, but they may have side effects. The homeopathic friends, they are nice, and being friends with them, you might get benefit, but you will definitely not get harmed.
Right.
So is that any way valid that Ayurveda does not treat emergencies?
No. See, we are talking about a system which has been there for at least 5,000 years. You think there would not have been any emergency medical conditions? So emergency medicine has been there. So if you look at, in those days, battles used to be fought. And Ayurvedic Vaidyas were always part of the army contingent.
A lot of trauma they must be.
Yeah, so so in those days there were some rules and regulations which were followed during war. So after sunset, the war stops for that day. So after the war stops for that day, the wounded soldiers are treated by the Ayurvedic physicians, and the wounded soldiers have to be up and functioning the next day. They are not given time, 1 week or 10 days to recoup, right? So how would that be possible if there were not emergency medicines? So painkillers were there, wound healing. Even now, wound healing in Ayurveda is way ahead of what modern medicine can do. So, the war medicine was an important part of Ayurveda, and it has fallen into disuse now. So if it's an emergency condition situation, the patients go only to the allopathic hospitals.
True.
So there is no chance for the Ayurvedic hospital or Ayurvedic students, Vaidyas, to treat the emergency conditions. Once you don't have that experience, you will not have the confidence at all. So, but I have seen Ayurvedic Vaidyas, treating emergency conditions. So I have seen Ayurvedic Vaidya treating heart attack as it occurs.
Wow.
And this was, the irony was that this was an allopathic doctor.
Who
And
had knowledge of Ayurveda?
No, this was an allopathic doctor.
Oh, the patient.
The patient was an allopathic doctor, and she had come for getting treatment for osteoarthritis. Okay, and she already had some other problem, right? And then, she had an attack, and she said, so heart problems are not incurable problems in Ayurveda. So Ayurveda classifies diseases, what is treatable, what is not treatable, and what is not curable but only manageable. So the heart problems never come under incurable diseases. Okay. So this doctor panicked, and she said that I'll have to go to get a ECG done and this and that. So this Ayurvedic doctor said that, I will treat you, and then you go and get whatever damn thing you want to get. So she treated, and then after that she went and got the ECG and all done. ECG was perfect.
Wow.
So emergency treatments are there. Even now there are Ayurvedic doctors, who take emergency cases. But in general, that training is not given.
True. So how does one find an Ayurvedic doctor who?
This is a very common question, and I have no good answer for it. I think this is something that I don't know, maybe Ministry of Ayush or these government bodies should come up with some strategy for it, because this is always a question that I'm asked.
How a directory of doctors.
So there are. Every state has a Ayush council, and they have a list of registered doctors. But the question is, how do we know who is good?
True.
And so, Ayurveda, although we have specialists like, you have MD in Ayurvedic ophthalmology, pediatrics and all. Generally, if it's a BAMS doctor, they look at all patients because, this kind of demarcation is not there. So if there is a problem in my eye, it also means there is a problem in the entire system and it is reflected as a problem in the eye. Maybe that's your vulnerable organ. So the treatment is always for the entire system. So BAMS doctor without any MD, in my opinion, they are the best doctors I have come across. And so you don't need, so the doctors, Ayurvedic doctors, they look at all kinds of patients. They can do that. But still there are doctors who focus on ophthalmology or on pediatrics. So I think we should have a directory of, and maybe, some kind of credit, something should be done, because this is a question that's always asked. Today, at least there were 5 people in the audience who came up to me and asked, how do we know who is a good doctor? How do we find out?
We could continue talking, actually. It's so interesting, and the wealth of knowledge, I feel we're just getting started.
Yeah.
But I think you have an appointment and you have to go. So I'm very, I hope to extend an invite that you come back again sometime.
Sure.
And for a more relaxed visit, where we can have a longer discussion.
Sure.
And it has been an absolute pleasure and such an honor to interact with you. Thank you so much for giving us this opportunity.
No, thank you so much for giving me the opportunity to share some of my thoughts, because I think it's very important that there is awareness, of what Ayurveda is, what it can do, what it cannot do. So no medical system is perfect. No medical system has answers for everything. But we are very lucky that, what is the strength of allopathy is different, and the strength of Ayurveda is slightly different. I think we should be we should feel blessed that, we have 2 different systems which are there to help manage the health and disease. But there is, as I said, there's a lot of misinformation about Ayurveda. And what pains me most is that, our acharyas, they had spent their entire life, looking at patients, documenting their observations and giving us all these on a platter, right? It's ready to use information. And it is of no use to Indians, right? You look at we are the diabetic capital in the world. I do not know what other diseases we are going to be number 1. What is the need? See, diabetes is a diet and lifestyle related disorder. We are sitting on a wealth of information as to, about diet and nutrition, right? And all this information is of no use to Indians. So it really, really pains me. And,
Do you see a silver lining anywhere?
See, I'm basically an optimist. I'm never a pessimist. But I would like to believe I see a silver line. I'm not seeing it. I'm not seeing, not because I'm a pessimist, but because, of this over enthusiasm. And you have people with very good intentions for Ayurveda.
But half-baked knowledge.
Yes. They do more damage. They do more damage. So, that it is creating a lot of problems for Ayurveda. And it is, see, let me put it this way. If tomorrow the billion people of India say that we are not going for allopathy, all of us are going to come for Ayurveda. Ayurvedic fraternity is not in a position to deliver.
Sure.
Right? So that is, people like Dr. Girija and her generation, they would be gone. So you have this confused set of students, who have not been trained properly. And we don't blame the children. The children are bright, but they need to be trained properly, right?
Absolutely.
What will they do? So there may come a time when the West is looking very closely at Ayurveda. Just like, yoga has
gone to the West and then has...
It is called cardiac coherence now. Yoga, it's not yoga. It is cardiac coherence.
Wow.
things will be appropriated, and we can't blame them. We can't blame anybody except ourselves. So this is likely to happen to Ayurveda. Sometimes I feel that because the Westerners do a very professional job, if they decide to do something, they go to the depth of it, and there is professionalism, which is something we need to learn. And we are just fraught with emotions. We are either left, we dump everything, or we are right. That objectivity is something we need to learn. So sometimes, I feel maybe it's better that the West learn about Ayurveda and bring it back to us. But as an Indian, it pains.
True.
But we are not doing things properly. We are honing our skills to do mess up things. That's all I can tell. As diplomatically, it's not very diplomatic, I know.
No, but I definitely see a silver lining, especially in work of people like you who are...
See how long people like me. So life is anitya, right? I'm 60. Next year, I'm 65. Every day is the way things are, every day is a bonus. We all come to go. We don't know when we are going to go, right? I'm not a 30 plus or 40 plus. Even if I'm a 30 plus, you don't know what is going to happen tomorrow.
True.
So one person cannot change things. This is why, I give non-stop lectures. So I don't say no to anybody, even if it is a shadow of a person asking me for a lecture. I give the same passion, the same enthusiasm. So, and there are quite a few of my, they have become friends now. They come for my talks on Ayurveda. It's a repetition. So, but you know what they say? They say, I have heard your talk so many times, but it's the same enthusiasm, it's the same passion. It's as if, you are giving me fresh information. It's like, Ramayana and Mahabharata, how many ever times you read, it's still, you are wondering what's going to happen.
Absolutely.
Next.
Every Ram Leela, you attend with...
You know the story, you know the end, you still, so, they say that. So, I feel it is very, very, I believe in sharing knowledge, and I feel this is something within my hands. And so it is under my control. So, I give non-stop lectures. And as I said, last week I gave about 7 lectures. And again, in another 3-4 days' time, I'm again giving a lecture. And it's my duty. It's my duty.
Thank you so much. Thank you so much. It has been so wonderful. It's a very small talk that we had. I wish we had more time to continue this conversation. But thank you. Thank you so much.
Thank you. Thank you so much. Thank you for having me here.
Thank you for joining us for this episode of KanaCast. Please stay tuned for more episodes in the future. Until then, from the entire KanaCast team, namaste and goodbye.